Welcome to another edition of the Business and Personal Podcast. And today we're joined by Dr. Earl Bogrow of the Dental Center for Sleep Apnea and Snoring. That's a mouthful right there. Dr. Bogrow, thanks so much for joining us today.
Thanks for having me.
And we're also joined by one of his patients, Deborah, who's going to tell about a great success story she had with Dr. Bogrow. Deborah, also, thanks for joining us.
Thank you. Thanks for asking me.
So we're going to talk about a topic that I've become really intrigued about going back on a couple of years now since I first met Dr. Bogrow, and I was researching just the sleep apnea category in general and started reading about dental sleep apnea and became very intrigued. And Dr. Bogrow made a massive career shift because of a personal issue with sleep apnea way back in 2008. So Dr. Bogrow, tell your story about how you made that shift and where you're at today.
Okay, I've been a general dentist. I graduated University of Michigan Dental School back in 1979. Spent a couple years working for public health department, actually in Honolulu, which was a great experience. Came back, set up a private practice in Southfield, Michigan, where I've been ever since, and love dentistry. Dentistry has been a passion of mine. I love the field. I've helped a lot of people. I used to say I love people, help people save their teeth. Now I say I help people save their lives and their relationships. So it's a different thing. And I got involved with this whole field of dental sleep medicine, or even sleep medicine, because of my own experience. Back in 2008, I was in my early 50s. All of a sudden my wife started observing or complaining that I was snoring more. My snoring was getting worse. She says she looked over, and at times she said she didn't think I was breathing, or I'd be making little gasping noises, and I'd be waking up several times during the night, where that never used to happen. And I would be coming home from work more and more exhausted. And like most people, or most men especially, I was in denial that I had a problem. Many people think snoring is just a laughing matter. Oh yeah, they snore and don't deal with it. So I mentioned to my physician at a physical, and he said, well, let's give you a sleep test. And I'm thinking, why would I need a sleep test? Well, that's for sleep apnea. And at that time, I thought the only people who got sleep apnea were people who weighed 300 pounds with a 20-inch neck and walk around with droopy eyes. Here, I run marathons. I bicycle thousands of miles. I consider myself very health conscious, but I took this test, and where you go into a sleep lab and they measure they measure what sleep apnea is, and I can get in that in a few minutes. But in my case, it came back with a diagnosis of moderate to severe sleep apnea. And when I started to read about the correlation of sleep apnea, and all sleep apnea is a closure of our airway when we sleep. Let's kind of give a picture of what sleep apnea is, or at least the definition. Sleep apnea is a closure of the airway when we're asleep. When we're up during the day, we can generally breathe through our nose, we can breathe through our mouth, we don't stop breathing during the day, we don't snore during the day. Where sleep apnea goes right in the back of the throat, between the back of the tongue, the thing that sticks in the back of the uvula, and our throat and our neck muscles. But as soon as we go to sleep, two things generally happen with most people. When we start to fall asleep, our lower jaw tends to drop back. Our tongue tends to drop back. And all of a sudden, that space that's wide open during the day gets minimized. And as it gets minimized, if the tissues get too close together, they start to flutter against each other. That's what snoring is. Snoring is one thing, sleep apnea is another. The next step that typically happens, and I always use the analogy, imagine a paper straw. And let's say that straw is wet in the middle. And then let's say you take that straw and you put it in a thick milkshake and you start to suck through it. What happens in the middle of the straw? It collapses shut, right? Well, the same principle can happen in your throat. You're breathing. If your airways gets too small, it starts to flutter, causing snoring. And 7 out of 10 people who snore have sleep apnea, statistically. So then you're breathing, you're snoring, and then just like that paper straw, boom, the tissues stick together. At that point, it doesn't matter how much air is in your nose, your mouth. It's like taking a garden hose and bending it. You're not breathing. And when I give lectures, I usually start by saying, you can go 3 weeks without eating, you can go 3 days without drinking, but you can't go 3 minutes without breathing. You have to breathe. And our brain has all these sensors that tell us, that say, hey, we're not breathing, or are monitoring what's happening. And the minute we stop breathing, all of a sudden, there's the brain sends a message to the body, and there's a release in our system of a little jolt of adrenaline and cortisol. And people who have sleep apnea will tell, they get a gasp or a cough. Some people, it's really subtle, where they might just take a breath, turn over, and not even know they're waking up, but they start to breathe again. And then a few minutes later, the same process happens again. They start to relax, they're snoring again, it closes again. So that continual process of the airway minimizing, closing down, and then boom, reopening. It's like getting a little espresso in the middle of the night and you're waking up. And that affects your whole system. It affects your sleep cycles, everything about, and then you wake up in the morning, and most people with sleep apnea, they wake up no more refreshed than they went to sleep because their whole body is stressed out. So in my case, let's go back to my history. So I had the sleep test, I was tested, and then I started to read about the correlations when you have this, correlations of sleep apnea and heart problems. Because every time you have one of these episodes, it's like a jump start to the heart. So there's a significant increase in the possibility of having heart disease, of having strokes, of having diabetes, of having acid reflux, of having dementia issues. Because every time you have one of these episodes, there's a decrease in the oxygen level of your blood, and then boom, you can't think straight. You become foggy, and that's another common symptom of sleep apnea. So when I started to read about all these correlations, and then I looked at my family history, and I see my dad was a pretty heavy snorer. My mom had dementia issues before she passed, and I said, hey, what do I do about this? And back 12 years ago, the only solution was a CPAP. CPAP stands for continuous positive air pressure. It's considered the gold standard. 9 out of 10 sleep doctors who diagnose sleep apnea will tell a patient to get a CPAP. It's something that goes over the nose and mouth, and it's like a bellow in a fireplace. It blows air down your throat, opens your airway, you don't snore, it works. The biggest problem with the CPAP, and I find that out myself, is compliance and being able to tolerate it. Statistically, 50% of the people who get a CPAP can't wear it, or has a problem with it, or they don't wear it enough because it's a hassle. Traveling is a hassle. Every part of it is a hassle. So in my case, I got a CPAP. I'm very health conscious. I wanted to make sure I was okay. I didn't like it, but I knew I needed something. And that's when I started reading in my dental journals about the use of these dental mouthpieces instead of a CPAP. And I learned about it. I joined the Academy of Dental Sleep Medicine, and it was all for my personal being at the time. And then I had an appliance made, which I can show you if you'd like. And to me, it was so successful. I didn't snore anymore. I haven't had a sore elbow from my wife elbowing me to say they're snoring since then. I don't wait, instead of waking up 3-4 times a night, if I wake up once, it's a lot. And I get a good 7-hour sleep every night. It changed the whole course of my life, really. And it was so successful that I started to study it more extensively. In 2012, I became certified by the Board of Dental Sleep Medicine. Legally, any dentist can do this kind of work, but there's only a very small handful of dentists, especially in Michigan, who've gone through any certification. And then I started treating patients. And then again, I saw that there was a good niche for this. People needed this kind of therapy. So I had a dentist who was working for me take over my general dental practice. And then I dedicated my practice to just people who have sleep apnea, who needed oral appliance therapy instead of using a CPAP or instead of surgery. There's 3 solutions if somebody has sleep apnea. 1 is a CPAP, 2 is surgery, which is really extensive, which I don't think we even need to talk about today. And the 3rd is this dental appliance. And the whole premise of how these dental appliances work is that and let me back it up. It's the same principle. Let's say somebody's unconscious and they're administering CPR to somebody. If you've ever taken a CPR course, the first thing they teach you in resuscitating somebody, if somebody's unconscious, is pull the neck out, chin forward. Why? to open the airway. It's all about maintaining an open airway. I could sit here right now, Ryan, and I have a small airway, and I can make a snoring or snorting noise really easily. But the minute I posture my jaw forward just a little bit, I can't do it because your tongue is attached to your lower jaw. When you move your lower jaw forward, it opens your airway and stops it. So that's the principle behind it. Now, does it work for everybody? If somebody's too obese, I don't care how far you move your jaw forward, the neck muscles and fat could close off. So the American Academy of Sleep Medicine has come out with a statement that the dental appliance therapy is just as effective as CPAP in most cases of mild to moderate sleep apnea, or even in severe cases where people can't tolerate the CPAP. Something's better than nothing if they can't tolerate the CPAP, if they know they need some kind of work. So again, it changed the whole course of my career. And then I was invited, I met the dean of University of Michigan Dental School, which has been the top rated dental school in the country for the last number of years. And I asked her, is there anything in the curriculum for students on this? And she said, well, they get a little bit. And she invited me to give a presentation to the students. And then they asked me to come aboard. And now I am an adjunct clinical professor at University of Michigan as they're progressing and utilizing and teaching this more. So by myself being treated so successfully, and then my practice, it's changed the whole course of my career. And I basically reinvented my whole career in my 60s. I'm 67 years old. I love what I do. And again, I've had my office in Southfield since 1980. Again, as you can see, I get excited and passionate about this because I know I can help a lot of people, and I have. And it's been really fulfilling for me to do what I do.
I knew you'd be the perfect guest to have on because I could just ask you one question and you can go on with a very engaging and articulate answer. And you had me, tuned in the whole time there. Just such an awesome story. And just talk a little bit about what that has done for you personally, because that's obviously a massive transition, but how much satisfaction have you gone from making that change?
Well, again, I love dentistry, so it wasn't like I was needed to get out. A lot of dentists get burned out after so many years. I've loved dentistry. I feel very skilled at what I do. But this is a niche that I really found that's necessary. People appreciate what we do. It's amazing if you just start asking people. It's amazing to me how many people have either been diagnosed with sleep apnea, or have been treated or tried a CPAP, or know they have it, but they don't want to do anything about it. Once you have the sleep apnea, once you have this airway, it's really an airway problem. Once you have this, you have the good and bad about sleep apnea, if there's anything good, is you can still function, especially mild to moderate sleep apnea, but you're just not at your best. However, in certain cases, people do die from sleep apnea. If your airway gets closed off, who is it? Reggie White, a football player, I think it was the Green Bay Packers. He died from sleep apnea because he stopped breathing. Judge Scalia, Supreme Court judge, he had a CPAP. He didn't use it. He died. People can die from this, but in most cases, you can still function, but you're just not at your best. And they've shown it decreases not only your lifestyle, but it decreases your lifetime. They've shown studies that moderate to severe sleep apnea will decrease your life by 10 to 15 years. I mean, again, it's a social issue. It's a health issue. And you can't pick up a magazine now without reading about sleep apnea. In fact, if you want to read an incredible book about sleep, there's a book called Why We Sleep. It's by an author, Matthew Walker. And if you read this book, it's amazing. In fact, I'm going to read one little pat from this book. And it starts this paragraph, an amazing breakthrough. Now listen to this. Scientists have discovered a revolutionary new treatment that makes you live longer. It enhances your memory and makes you more creative. It makes you look more attractive. It keeps you slim and lowers food cravings. It protects you from cancer and dementia. It wards off colds and the flu. It lowers your risk of heart attacks and stroke. not to mention diabetes. You'll even feel happier, less depressed, less anxious. Are you interested? What's that solution? Sleep, a good night's sleep, for God's sakes. How many people get, in our society today, it's almost been kind of a badge of courage. Oh, I don't need more than 2-3 hours sleep. Hey, the more sleep you have, the better you're going to function, the more effective you're going to be in anything you do. So when you're walking around half crazed, not to mention auto accidents, 1 out of every 3 auto accidents, it's somebody dozing off, whether it's sleep apnea, but some kind of sleep deprivation. We're in a sleep deprived society today. There's no question about it. So again, but there's a difference of being clinically sleep deprived, which is what sleep apnea is, or electively sleep deprived. Some people just don't get enough sleep. So for those people, get more sleep. For those who have sleep apnea, it doesn't matter if I get 5 hours or 10 hours. If I don't wear my appliance, if I don't get it treated, I'm getting poor quality sleep. There's quantity and quality, and you need both.
And you touched on how deadly sleep apnea is, and that was one of the main reasons I wanted to bring you on. In normal times, it's a very deadly disease to have, but then you factor in COVID, and you hear about all the people at risk that have a higher risk of dying from COVID, and I would imagine sleep apnea ties into that. I know this is kind of a loaded question, but with the onset of COVID, how has that affected your industry?
Well, it's really COVID, just like that, affects your airway. Stop, again, you get it into your lungs and you can't breathe. So it's kind of an extrapolation of sleep apnea, but worse. But what it's affected my business is pretty dramatically. In fact, the American Academy of Sleep Medicine, there's 2 academies. There's American Academy of Sleep Medicine, American Academy of Dental Sleep Medicine. We're like the little brother to the physician world. We work together. It's not us versus them. It's what's better for a patient. Is a dental appliance better? Is a CPAP better? We're looking at what somebody can tolerate, what's best for that individual. But in COVID times, the American Academy of Sleep Medicine has come out with the statement that the dental appliance should be first. In fact, I have it right here. Clinical practice right here. Oral appliance therapy should be prescribed as a first-line therapy for obstructive sleep apnea during COVID-19 pandemic. Reason being, when you use a CPAP machine, which blows air down your throat, it creates aerosol. So if somebody has COVID already, it's gonna create aerosol in the room, and their sleep partner and anybody in the house is gonna be more likely to get it. So it's actually increased my business because I get more referrals from sleep physicians who they know their patients shouldn't get a CPAP. So and the research now has come out that the dental appliance therapy, the studies have shown in the right case, given the right way and prescribed the right way and followed through the right way, can be just as effective as a CPAP in many cases. And again, I refer a lot of people to have CPAP because the CPAP is a great alternative. I'm not saying it's not good, and I think Debbie could give her experience of that in a few minutes. And she's a very common type of reaction to people getting the CPAP, just hard to wear. Dental appliance compliance is real easy. It's a little dental appliance, and I'll just show you real quickly what it does. There's 2 pieces. They go in your upper and lower teeth. One teeth fits on your upper teeth, and the whole principle, as I said, it guides your jaw forward. So let me show you. It does this. I can still talk. I can still drink, but you see, my lower jaw's out, and I can't stop breathing. I can't make that snoring noise. In fact, there are many athletes today who wear appliances similar to this because when your lower jaw's forward, it creates more airway exchange, and it increases performance for athletes. So the same principle of air exchange and opening up your airway as much as we can be beneficial in many different things.
Watching you just do that brought up a question in my mind. So if someone, say, had Invisalign done and they wear retainers at night, can you have those conform to like the shape of what their retainer was to still accomplish that? Or is that?
Absolutely. In fact, it's almost like a retainer. In fact, like I say, legally any dentist can do this, but you have to really know the subtleties of this. First of all, there are over 100 appliances that have been approved by the FDA for snoring or sleep apnea. I'd be the first to tell you a very high percentage of the appliances on the market today, whether it's online, over the counter, even some that dentists make, it could work, but it could also cause other side effects. For instance, some of the early designs of this appliance, when in this whole field, which is only 15, 20 years old, with thrusting we got as far as it could, it might work. People develop all kinds of jaw problems. The last thing we want to do is solve one problem and cause another. So the biggest change in the development of these products, and the only ones that I use, are ones that are custom made and adjustable, meaning we just don't press the jaw. We slowly but surely guide the jaw to different positions until we find, my job is to find the optimal jaw position for that individual patient. I've narrowed this down from about 100 appliances to about 5 that I think are effective. And I diagnose one over the other depending on the number of teeth somebody has, the size of their jaw, the size of their tongue. And I individualize this as much as possible. Some people, it needs to be very specific. Some it could be more general. And again, so it's not one size fits all. It's what's best for that individual. And 2 other side effects, if not made right, if not adjusted right, is it could put pressure on the teeth. You mentioned some Invisalign. The last thing somebody wants to do with his Invisalign is to have their teeth start shifting again. So the only appliance I work with are ones that cover all of your teeth. So we're basically giving you a retainer for your retainer. And then I also give my patients the third side effect that we don't want to happen. When you have your jaw postured all night and you wake up in the morning, it takes a few minutes for your muscles to relax. So we give a second piece, what we call a morning repositioner, which I don't have with me right now, but that we take a recording of where somebody's bite is before we start, and they put that in the morning, and it's kind of a muscle memory. There's Debbie has it right there. Muscle memory that brings your bite right back to its normal bite. So I am just as proactive in preventing side effects as I am in getting this to work for our patients. And that's, some of the dental appliances got a bad name because they caused all these problems. But if it's treated correctly, you're not going to get it. And that's how I base my whole practice on is again, I work with sleep doctors. We talk about what's best, why this appliance might work better than a CPAP. It's a collaborative effort between myself and the sleep doctor. It's not us versus them. It's not dental versus medical. It's all one thing. There's the whole medical dental connection. Dentistry has come a long way in being able to diagnose a lot of medical problems. I mean, I go a whole episode on just that, but especially with sleep.
Yeah, the customization is vital, I'm sure, and
Absolutely.
that'll be a good transition here. We're going to talk about one of your custom scenarios here that you were able to solve a problem with. Deborah, thanks so much for joining us. I enjoyed our conversation offline. And you were explaining to me how much of a challenge you were having with the CPAP, and then you transitioned over to this and changed your life. So why don't you just take us through everything that Dr. Bogrow did to help you out?
Okay, and I could certainly say that everything that Dr. Bogrow said, I'm a classic case for all of those items. I'm not overweight. I mean, I have COVID weight now, like everybody else. But you always think of the classic heavy male, and that's not true. And I couldn't understand why I couldn't watch a movie, why I'd sit through meetings and just hardly be able to keep my eyes open. And I had an executive position, a working full-time mom, and so you just equate it to you're tired. And so I did the sleep study, tried the CPAP machine, because that's basically all that I knew about. And for me, and again, like Dr. Bogrow says, everybody's individual. You have to look at yourself and see what works for you. The CPAP machine didn't work for me. You subconsciously take it off during the night because you have to get used to it. And as I was making it through an entire night, I literally couldn't get out of bed because the air pressure that it pushed in me was not coming out. So it was all in my stomach. I couldn't even get up. And they were going to readjust the air pressure and told me to take, gas medicine before I go to bed and all this and that. And it wasn't working. So I gave up. And come to find out, after I did get the appliance, one of my classic symptoms was, and because Dr. Bogrow mentioned, you have to sleep. You can go so many days without eating, but you have to sleep. And because I wasn't sleeping, about every 4 to 6 weeks, I'd get a low-grade fever, and I would be knocked out, comatose, and sleep for 2 to 3 days. And I couldn't understand why this kept happening. And I'd go work out, go back to work, and then in a few weeks, this is happening again. And I'm like, nobody could figure out what was wrong. So after doing some research and talking to various dentists, like he mentioned, a lot of them offer various appliances, but I was so desperate to have something that really worked that Dr. Bogrow was referred to me by my dentist who retired, and they studied together. So once I had heard that he had studied the sleep appliance and sleep apnea, I'm like, okay, I'm going to move forward with this. And that's when I contacted Dr. Bogrow. And again, he said, he fits you to the appliance that he thinks is going to fit you. And when he mentions the smaller passageway, that's what I have. And ironically, and I don't have a problem talking about it, it's kind of funny, I have a fat tongue. So, with my tongue going back during the night and closing that passageway, and again, as Dr. Bogrow mentioned, and I have to say, I learned so much about sleep apnea and the appliances and everything from Dr. Bogrow, because I ask a lot of questions. So, I have like probably 1,000th of the knowledge he does, but I understand it more now as far as not being related just to your external physical side. So, as you age, also your muscles get weaker. So your throat muscles aren't going to be able to expand to open that passageway for you. So that's why, I'm like, why do I have sleep apnea now? I never had it before. So that's when he measured me, he came up with the appliance. My numbers were at 40. Mine improved to 5. Even my sleep doctor was amazed at how well I did with the appliance. And actually, that's when I realized why I was getting sick all the time. And like, again, it was just a low-grade fever. And I was sleeping so hard. I mean, it was like I was out of the world. But it was my body's way of telling me, stop. You need this rest. Like Dr. Bogrow said, that you do need the rest. So, my appliance is one of the 5 that he utilizes. It's a little bit different than the one that he has. I brought it with me today. You can see this is what it looks like. This is the bottom portion that brings my jaw out when I'm wearing it. And this is what he mentions, that it'll get adjusted gradually. So it starts here and then it'll gradually move out. And it could take, I don't know what, on an average of 6 months or longer, because if you do it too fast, you'll start having pain in your jaw. So he's really, really careful about that so that you don't have that discomfort with wearing it, with putting the jaw out. So the funny thing is every time I come in for my appointment, as long as I've been going to Dr. Bogrow, what has it been, 8 years?
About 8 years.
Yeah. He'll say, are you wearing your appliance? I go, are you kidding? I would die without this, literally die. I mean, I don't have to be asked if I'm wearing it. I wear it all the time. And this is easy when you travel or go anywhere. You don't have to clean hoses. And again, the CPAP might work for some individuals, but for me, this literally saved my life. It did.
Yeah, don't leave home without it. And yet you touch on a benefit that I hadn't thought a lot about, but yeah, when you travel, so if you're someone that travels a lot, what a much easier way to go about it. So
This is my travel case.
that fits
That's
in
it.
just about any overnight bag,
Yeah.
easy
And
peasy.
then, you know, this is what I put on in the morning. So,
Going from a 40 to a 5, that's dramatic. Like, how quickly were you able to get your number down?
fairly quickly. I mean, you know, I guess I'll say for me, and I don't want to get Dr. Bogrow in any trouble, but when I called him, I was so desperate because I was not functioning. And I think we did our first consultation was on the phone for an hour or more. He asked a lot of questions to see if he can even help you. And then I went in and he takes all these measurements to see what appliance is going to work best for you. And that's when he said to me, you know, I have a small passageway and I have a fat tongue. So, but it, in less than a year, absolutely less than a year, 8 months at the most.
Wow, that's pretty quick. And Dr. Bogrow, looking back on working with Deborah, did you think she was the perfect candidate for this? That she was going to have a highest opportunity for success?
Well, she was very motivated patient, obviously, and she was, as she said, almost desperate that she needed some help. And you know, I try to under promise and over deliver is what I like to do. So again, I especially the more severe the apnea, and they rate the severity by this number that Deb mentioned, and that number is called the apnea hypopnea index. And what that number is the number of times in an average hour of sleep that your airway shuts down for at least 10 seconds at a time with a concurrent drop in your oxygen level of your blood of at least 4% in each one of those episodes. 0 to 5 times an hour is considered normal. 5 to 15 times is considered mild apnea. 15 to 30, moderate. Over 30 times an hour is severe. So 40, that means she was having an airway closure about every minute and a half. So how could you possibly get a good night's sleep? And again, the Academy of Sleep Medicine, the dental appliances mainly recommended for mild to moderate case. I've worked with many people who are severe and we've gotten some great results, but statistically, the more obese somebody is or the more severe, the less effective the dental appliance is in comparison with the CPAP. But let's just say that I could reduce somebody's apnea problem in 50%, even if I can't get it 100%. Is 50% better than nothing if they can't wear a CPAP anyway? I think it is. So again, we work with somebody that there's a period of time that Debbie mentioned. I call it the tweaking stage, where I work with somebody, I see them 2, 3, 4, 5 times until we at least subjectively think it's working. Then part of my protocol, sending them back to the sleep doctor, have a second sleep study with it to verify the effectiveness. And if it's not quite, then we might move it out a little more. It's kind of a little game that we play of you know, where's that optimal position? And you know, it's sometimes tricky. And again, does it work for everybody? It works for most people. And again, there's certain people come in and I'd say, hey, you're much better off getting a CPAP. Please do. Try that first. If you really can't tolerate it, then come back to me. And again, so many people love their CPAP. Don't get me wrong. It's a great treatment, but it's also has a lot of problems. It's kind of a almost crazy. It's this bulky thing that fits in you that blows air down your throat. What can I say?
We're not here to bash the CPAP, of course, but what we're here for is to show people alternatives. And it's my belief there might be a lot of people out there that kind of know that they have sleep apnea, but they don't want to deal with the CPAP and go through the process, and educating those folks on other alternatives out there. So Deborah, I really appreciate you coming on to tell your story, because Dr. Bogrow can talk about it all day long, but to actually hear someone that had success with it, I think is so important. What would you say to people out there that might feel like they do have sleep apnea and have not done anything about it because they don't want to deal with the CPAP or just the whole process in general?
I would say you need to go forward. And, you know, a little bit of my fear too was like, am I going to have to wear this machine? I was single and, you know, am I going to have to haul it around and this and that? And, you know, when I couldn't wear it, I didn't know where to turn to or what to do. So go get your sleep study, find out if you have sleep apnea. You know, I realized my major symptom after, you know, I was cured from the sleep apnea. So there may be things that are happening to you that you're not even aware of. I mean, one of the, you know, all the studies, mine's not listed as one of the classic symptoms of, you know, getting the fever and having to sleep. So I'd say try it, move forward. You're going to feel so much better. I can't tell you. I could stay awake now. I can watch a movie and I'm not getting these classic symptoms. And, you know, another thing that happened to me, which I didn't know it was from the sleep apnea, was I literally jumped out of bed a couple times because I couldn't breathe, trying to get my breath back. So when you think
Wow.
about, you know, the individuals you mentioned that passed from it, I mean, I woke up and jumped out of bed, but I was in a panic. So
Wow.
it's worth it. I can't, again, I just can't tell you enough how much it can change your life. And you almost don't realize how bad you are until you feel good again, because it's gradual.
Well,
And
we love hearing.
I could jump in and say personally myself, I mean, I'm 67. I feel as good at 60 as I did at 47. I'm 67. I don't take any medications. I sleep 7 hours a day. When I talk to patients, and if I've missed 3 nights in the last 9 years, that's a lot. And if I do miss a night wearing the appliance, I feel it the next day. So, and I tell people, we're not solving a problem, we're managing a condition. If you use a CPAP, if you use a dental appliance, it'll work. If you don't, and when I first talk to patients, I talk about the triad of health. There's, you know, everybody talks about diet and exercise, but that third component of sleep is equally important. Any one of those 3 factors affects the other 2. If you're not getting a good night's sleep, it's tough to get up and I can't go get exercise. If you're not eating right, you just don't feel right. Any one of the 3 affects the other 2. So it's a balance. It's a lifestyle. It's not one thing.
It's not like it's not like an Invisalign where you wear it all day long for a long period of time until your teeth have straightened out. Then you only have to wear it at night. This is a commitment that you're doing it all the time. You're not just doing it here and there. You need, the problem doesn't just go away.
And I will say sleep apnea generally gets worse with age. Most, you know, the classic person, I think Deb alluded to it, is that old fat man. That's the classic person who has sleep apnea. But I have many patients in their 20s, 30s. I have many patients skinny as a beanpole. Some people just naturally have a small airway, genetically, physiologically, anatomically have a small airway. But two things that generally happen as we get older, and that's why sleep apnea does get worse as people get in their toward 50 and 60 and older, is one thing, most people gain a few pounds. Weight gain is the single greatest contributing factor, but not the only ones. But the other thing that you cannot control as we age is our muscle tone and our tissue tone become a little bit more collapsible. During the day, we're fine. Our neck muscles are pulled away, but at night, everything just sags a little bit more than it did when you're younger. So again, it's something that isn't going to go away. If you have it, typically it won't go. Weight loss is great. Body position is great. Doing certain things to help sleep. There's lots of things you can do to improve your sleep, even if you don't have sleep apnea. For instance, I mean, avoiding caffeine after, within 5-6 hours when you go to sleep. Alcohol is a muscle relaxer. Some people say, oh, I like to have a drink before I go to sleep. Well, it makes your sleep worse because you have a less amount of deep sleep and REM sleep when you have alcohol. And it's a muscle relaxer. It closes the airway more. So there's a lot of sleep hygiene things you can do to make your room dark so you can sleep better. There's a whole bunch of things to improve your sleep even without this. But if you have sleep apnea, that's a whole nother thing. So again, we can go all the way from talking about best way to sleep to how to treat sleep apnea. And we're kind of going off to the side of people who need it the most. But everybody needs to have a good night's sleep.
Well, Dr. Bogrow, I'd love to hear more success stories like Deborah's here. So what is the best way for people to get in touch with you, and give us an idea of how long the process takes?
Well, I don't work with somebody and I won't treat somebody unless they're diagnosed. We don't want to treat somebody. I have patients come in and say, well, I know I snore, just make me one of these appliances. And sometimes we can turn somebody into what's called a silent apneic, where we treat somebody and we don't even know what their numbers are. And we can be leading somebody down a false road that they're going to get sick and have a lot of problems because we don't know what they started with. And maybe it's so severe that they needed something else. So I work with sleep doctors. They can, most pulmonologists, I can give somebody referrals to different doctors. But once somebody's diagnosed, and this is covered, one other thing that's very important, this is a dental solution to a medical problem. So it is covered by medical insurance, not dental insurance. What I do different than most other doctors who do this, if you were to poll the few dentists that do this regularly, the fee if somebody doesn't have insurance, the fee is generally close to $3,000 for this kind of treatment. But what I do different than most other dentists, and most dentists do this, charge the patient up front, and then they try to get the insurance to reimburse the patient. I do it differently. I've gotten myself in network with most medical insurances, and we find that we have a medical billing service that does a pre-authorization. Most people have medical insurance. Their out-of-pocket expense is usually about $300 to $400, typically, aside from copay and deductible, which varies with every plan. So I do this in higher volume. But in order to be covered by insurance, you have to have a sleep study within a 2-year period, and you have to have a letter of medical necessity by a physician. As a dentist, legally, I cannot diagnose, but I can treat under the auspices of a sleep physician. So it's a collaborative effort working with different sleep doctors. If somebody has questions and concerns, they can always call me at my office in Southfield. And I don't know if you want me to give the number, but I could. Our phone number is 248-827-1144. You can go to my website, and there's lots of information. And you can just look under my name, under Bogrow, Bogrow, or you can go under Michigan Sleep Apnea Center.com, and they can find me via there. There's on my website, there is an assessment form that asks questions that kind of helps me help you go in the right direction too. So those are things that we can do. And I usually now, I think one of the positive things, if there's anything positive about COVID, is we do a lot more telemedicine interviews. So it saves people from coming into our office as much and contaminating ourselves and them. So I usually do my first appointment with somebody on an interview, kind of like this, and kind of answer their questions before they come in. And our office is very, I call it COVID conscious, meaning we don't have people wait in our waiting room anymore. We have air purifier. They wait in their car. We tell them to come right up. We don't keep anybody waiting. We keep our system going. We don't double, triple book. I got involved with this because I wanted to get off the treadmill of medicine and dentistry, where you just get people coming and going. So I really, what I loved about dentistry and what I love about what I'm doing now, as much as anything in helping people, is the personal relationships that we form with our patients. I mean, Debbie, she can say how we become friends with my right-hand barber in my office, who's probably the most instrumental person working with me. She does everything. She is one of the most knowledgeable people in the field. She backs me up. She's like I say, my right hand in the office, and she should actually, I should have had her come on this, but she's instrumental, and we build our relationship with our patients. And again, we're not a high volume pushing and in and out get people. We want to help people, and a lot of people need time. This is a serious thing, and people are not at their best when they're, when you're sleep deprived, you have less patience, you have that. So we've learned to deal with people, and we've seen changes in people's personality when they get more sleep, So that's one of the positive things that we do. And again, I'm doing this. Hey, it's a business. A business has to have profits, and we have to make it go. But again, I'm in the point in my career where I'm not going to rush. I'm going to spend more time. I'm going to build that relationship. I'm going to listen to that patient maybe more than I would have 20 years ago when I'm building a practice up. So again, I will tell you that my business is just kind of keeps growing, year after year. The more I'm known in the Detroit metropolitan area to do this, I get more and more referrals. So at some point I may have to bring in another person to work with, but right now I just love what I'm doing. So that's my sales pitch, if there is one.
You could have easily ridden off into the sunset with your regular dentistry practice, but obviously you were compelled to do something else. Your passion's easy to see, so it doesn't feel like a sales pitch to me. It feels very natural, especially because you were affected by this personally too.
It's funny you say it, because when I had another dentist take over my general dental practice, I told my wife, we could just go off. I've had a successful dental practice for 30 some years, and we're fine. But I found something that I really want to jump into, and she's been incredibly supportive and saying, hey, do it. If you feel this is important, do it. And so I give my wife a lot of credit too for helping, backing me and supporting me in my efforts because I'm as busy now as I ever have been. It's just different. It's a different kind of pressure. It's more, instead of dentistry where it's more hands-on, this is more personal relationship, more talking, more getting to know somebody and tweaking things. It's not as physically demanding as dentistry is, but it's still very mentally demanding, which is different. But I love what I do.
Right. And I'm sure you could talk about this all day long, and maybe we'll have you come on again because there's probably a lot more that we could talk about, even though we covered a ton here. And Deborah, thanks so much for coming on and telling your story. It really helped make this thing whole.
I appreciate it, and I can't say enough for Dr. Bogrow. And this isn't a paid ad, but
and I hope your mom is doing okay. I'm sorry to hear that your mom's not doing good.
That's okay. Yeah, she's well. She got the knee replacement, but yeah, it changed my life. And I talk to anybody that I talk to about it, that mentions the machine or mentions somebody else, or I refer him to Dr. Bogrow. I referred him to my doctor. I think he's one of the doctors that you work with. I referred him to my dentist because they'll get people coming in asking about it. It's life changing, because I would literally sit at my desk and nod off. And you don't know why, So I'm in love with my appliance.
Well, and great. I will say one last thing. Yeah. I personally have 5 appliances, maybe more. When something new comes on the market, I try it myself so I can tell a patient how it's going to feel. So the one I just put in my mouth is different. And I kind of, for me, any and all of them work just as successfully. As long as my jaw goes forward a little bit, I'm fine. So to me, almost any one works. Some people, it needs to be more specific, and there are different reasons why I give different appliances. But again, there's it's an assortment, but you have to be careful. You have to, if you get treated, make sure it's under somebody who following the regulations and the standards of the Academy of Sleep Medicine. That's the important thing. And I do that very strictly.
Yeah. When I was looking to do something other than the CPAC, that's what I found. And then when I had talked to my dentist and heard that both of you had studied this, that's when I made my decision to visit Dr. Bogrow.
Yeah, there's a lot of dentists out there that have made that transition. You were kind of a pioneer, it feels like, in this. But yeah, you do have to be careful who you're working with and make sure they have all the proper certifications, no doubt. So, well, thanks again to both of you for joining just great content. I look forward to putting it out there, and hopefully we can make a difference for at least one person out there.
Absolutely.
Thanks for having us,
Thank you.
Ryan. Appreciate it.
Absolutely.